You are dispatched to a rollover motor vehicle crash. Your patient, a 17-year-old male, was ejected and is found supine beside the vehicle.
Okay, I'm going to take BSI precautions. Is the scene safe?
The scene is safe.
There appears to be only one patient, and the suspected mechanism of injury is the motor vehicle accident. Since I suspect a C-spine injury, I'm going to request additional ALS assistance, and I'm going to have my partner stabilize the C-spine. General impression of the patient is that this is a 17-year-old male who was in a motor vehicle accident, so he might have serious trauma issues. Hello, sir. I'm with EMS. Can you hear me? Patient is not alert. I test. In order to respond to verbal, I'm going to test for pain, and he responds to pain. I'm going to. The chief complaint is that this patient has no level of consciousness, so I'm going to assess the patient's airway. I'm going to open it with a jaw thrust, and since the patient is unresponsive, I'm going to insert an oropharyngeal adjunct. I'm going to check the patient's respirations.
There are 14 respirations per minute, and they are non-labored.
Okay. Since the respirations seem fine, I'm not going to administer any oxygen. I'm going to check for circulation now. I do not feel a pulse, any radial pulse, so I'm going to check the carotid artery.
His carotid pulse is 72 and weak.
Okay. His skin appears warm and dry. Is that correct?
That is correct.
Okay. I do suspect spinal shock, so I'm going to keep the patient's temperature maintained and address any signs of shock as they come up. Okay. Since this, I don't see any major signs of bleeding either. Is that correct?
That is correct.
Okay. So since this is a spinal injury, this patient is not critical, so I'm going to transport to the hospital immediately. I'm going to begin with my secondary assessment. I'm going to palpate the skull. I'm using DCAT BTLS, which is deformities, contusions, abrasions, penetrations, burns, lacerations, tenderness, and swelling. Do I find anything on the skull?
Nothing abnormal.
Okay, I'm going to check behind the ears as well. I'm going to check the face, and in the nose, and in the mouth.
There are no abnormalities.
Okay, in the ears, and I'm going to check the responsiveness of the pupils. Any abnormalities?
Nope.
Okay, so next I'm going to move on to the neck. I see no tracheal deviation, JVD, or... Oh, and I'm also going to check the C-spine for any step-offs, and I do find a step-off. So I'm going to stabilize the patient in a neck brace, and then I'm going to move on to the chest. I'm going to palpate the chest, and I don't hear any sound of crepitus, so I don't suspect any broken ribs. I'm going to auscultate the patient in the 6 regions for breathing, and it sounds normal. Okay, I'm going to move on to the abdomen and palpate the 4 quadrants of the abdomen, and that feels normal. I'm going to check the pelvis by pushing down and in. That seems normal as well. And I don't have any reason to suspect any trauma to the genital region. So I'm going to move on to the lower extremities. I palpate the lower extremities and don't find anything. But I'm also going to check for responsiveness. So I pinch the patient's feet and there doesn't appear to be any response. I move on to the upper extremities. And again, don't find anything, and I'm going to check response there, and there doesn't appear to be any response. Lastly, I'm going to log roll the patient onto their side and check the length of the spine. And I don't find any other spinal deviations. As the patient's log rolled, I'm going to insert a backboard beneath them, and then roll them back onto the backboard, and then secure them on there. I'm going to check the patient's vital signs. I'm going to check his pulse again.
It is still 72.
Okay, I still don't have any radial pulse. I'm going to check his respirations again.
14 and non-labored.
Okay, I'm going to check the blood pressure.
90/50.
Okay, so since The blood pressure is lowered. Going to, again, suspect spinal shock. And I'm going to reassess this patient every 5 minutes. It's critical. And I'm going to pass on the following information to the hospital. 17-year-old male involved in a motor vehicle accident with apparent trauma to the C-spine, signs of spinal shock, and no signs of responsiveness to the upper and lower extremities to either pain or touch. Yeah.